Hello, everyone. Good morning. I'm sorry, not good morning. Hello, everyone. Good afternoon. Thanks for attending this lecture. So today's class will be discussing the nervous system infections. So we'll be discussing some diseases that affect our nervous system, and these are the diseases we'll be talking of. First one is meningitis. The next one will be meningoencephalitis. The next one will be acute encephalitis. Next one also will be subacute encephalitis. And then we talk about rabies, we talk about poliomyelitis. And the seventh one will be tetanus, and the last one will be botulism. So now let's dig into it. Let's discuss the first one, which is meningitis. So with meningitis, what we normally see mostly is you have inflammation of your meninges, which is mostly the space between your brain itself and your cranium. So there's a space or a structure between the brain and your cranium, and that is meninges. So you experience inflammation in that area, your meninges, and the inflammation can be acute or chronic. And worst case scenario, you experience a very worse or severe headache. This disease, meningitis, is caused by virus, bacteria, and fungi. And then some serious form of this acute meningitis is caused by bacteria. The typical symptoms are you having photophobia, stiff neck, headache, fever. And then it's transmitted through droplets or vehicles such as food. There are also non-infectious causes of meningitis which exist as well, but these are less common. And since this disease affects the CNS, the most common the entry of this disease is within the CNS. And previously, it has also been known to have a cross link of respiratory virus infection. Okay, let me say something more about this. So this can also manifest as we have some organisms which are more likely to cause acute meningitis compared to the other one. So within the viruses and the bacteria, we have some that can cause more acute compared to the chronic one. And mostly in a healthy person, it is very difficult for organism to gain access to this nervous system. So unless you have stubborn ones such as the viruses and bacteria that can easily attack. Sometimes when your nervous system is also weak, it makes you prone to getting this disease. So next one, let's talk about Neisseria meningitis. So this is caused by gram-negative Diplococci bacteria, aka meningococcus, and is associated with epidemic forms of meningitis. It's mostly more seriously form is the most serious form, the acute meningitis. We have about 25, it comprises of about 25% of all meningitis case. And when you get infected with these, you can have red or purple lesions, which is called petechiae or vascular damages. We have vaccines available from age 11, and we also have boosters. This is very common in children, so that's why we have vaccines that targets them. But basically, what it does is it damages your blood vessels, um, which are caused by cytokine release by white blood cells because they have come in contact with the pathogen, and it will lead to your vascular blood cells being collapsed, which will lead to hemorrhages, as we can clearly see some from here, and also crop or red purple lesions, which we can see appearing on your trunk or your appendages. So next one on our list is Streptococcus pneumoniae. Um, This one does not cause petechia or the red swelling that we've seen earlier on. This is a gram-positive Diplococcus bacteria, aka pneumonococcus, and it causes majority of bacterial pneumonias that we know. Most frequent cause of common acquired meningitis, and it mostly occurs to patients with underlying susceptibility, and then it has been known to cause a miscarriage. It has been known to cause a carriage rate over 30% in some populations. There are three vaccines available. So even though this is a terrible disease, there are vaccines available to protect us. The next one is Haemophilus influenza, which is a gram-negative coccobacillus. Um, we have vaccines available that we give to infants for this, and these diseases, humans are the only reservoirs that is known. So the gram-negative coccobacillus causes this infection, and then mostly what you experience is it causes most of the severe forms of meningitis that we know, and often we call it HIP or stereotype B. That's the most common cause that we know. And as I said, vaccines are available and they are given to infants. The vaccines have been known to reduce asymptomatic carriage rate and has virtually eliminated HIPs in the United States. Next on our list is Cryptococcus neoformans. It's caused by fungus. It's widely spread in human habitat, and it's a chronic meningitis with gradual onset of symptoms, and it's more popular among AIDS patients with fast onset and acute disease keep on happening, and this is mostly due to the immune system of these AIDS patients, being a little bit being less strong. And as you can see, they have spherical to oval shape with large capsules. So clearly you can see they have the spherical to oval shape and they have larger capsules than normal ones that we know. And transmission is through bird droppings, specifically when you have pigeons which are extremely problematic and who goes ahead away kind of defecating all around. Um if they have these what do we call it, diseases or something as a career, they can easily send it around. If they have this fungus in their droppings, they can easily send it around as a career. I'm sorry, as a mediator to send the disease all over. Next on our list is coccidiosis, which is known as a valley fever. This is a true symptomatic fungal infection of high virulence. So it's caused by virus with distinct morphology. You have them at 25 degrees Celsius. They have moist white to brown colony with abundant branching hymphae, as we can see. And then at 37 to 40 degrees, they are in their parasitic phase and they have small and spherical shape. So this is 25 and this is at their 37 to 40 degrees phase, which is basically the parasitic phase. They are specific to geographical locations, as we can clearly see. Within this area is high endemic, and then here in the yellow one you have and the less more of a moderate endemic, and then we have here um this is the I think it's not yellow. So between this, basically this color shows a moderate endemic, and this one shows the suspected endemic. This is more popular around Southern America. It starts as pulmonary, and then finally it just move to the meninges, and then kicks in with the true violence nature. So it's been known to occur naturally in natural reservoirs that we know, and then so there are two causative organisms that have been identified downstream of these. The first one is C. immunitis, which causes disease and is been known to be present here also in the United States, in California precisely. And the C. Posada C is the one which is normally found in northern Mexico, as we can see in this geographical distribution. So now let's move to the next one on our list. So the next one on our list is viral meningitis, which is a 4 or 5 meningitis, which is one of the most common meningitis we know. Is in every 5 cases of meningitis, you have 4 of them being caused by viral meningitis. Majority of these cases have been recorded in children. About 90% is caused by enteroviruses. So you have and sometimes HSV. So and we also have other herpes viruses that is known. We also have HHV6, HH7, and HHV3, and the list goes on and on. And finally, we have our big brother HIV that can manifest as meningitis also as well. This is milder than the bacteria and the fungal meningitis usually that we know, and this usually resolves within 2 weeks. So it's more like comes as a virus, and within 2 weeks your body fights it, and you become fully healed. The mortality rate is less than 1%, as it's not common for people to it's not common for people to die of it, because it usually resolves in within 2 weeks. The next on our list is neonatal and infant meningitis. And then it's half a mobility has increased, but the mortality rate has significantly declined. So there's a high rate of getting infected, but it doesn't cause much of um, it doesn't cause death. It's mostly caused by common streptococcus. It's mostly caused by common bacteria. An example includes Streptococcus agalactiae, and also Escherichia coli. And we also know that it also have other bacteria that it causes, such as Listeria monocytogenes, and also Pronobacterial sakazaki. It's transmitted mostly through vertical transmission, and where you have an infection transmitted by mother in utero or during passage through the birth canal. So because of this, it's more common among premature babies, and it contributes mostly to more premature baby survival rates, because of how the spreading, because of how it's being spread mostly through the vertical transmission from mother to patient. Next one is streptococcus. So now let's talk about the different bacteria that contributes to this. So the first one that we talk about is Streptococcus. As I mentioned earlier, Streptococcus agalactiae. So agalactae or agalactia, depend on the one who's pronouncing it. So these are group B streptococci. They colonize 10 to 30% of the female genital tract. They most frequently cause they are the most frequent cause of neonatal meningitis that we know. We can easily treat these bacteria with 4-penicillin gel sometimes, and they are supplemented with aminoglycosides. Next one on our list will be E. coli. The most common one is the K1 strain, which is the second most common cause of neonatal meningitis. This is most common in premature babies, and their prognosis is poor, so you have about 20% mortality rate. And then they also causes brain damage among those who survive. So it's also mostly transmitted through mother's birth canal, as I mentioned earlier on. So the next one is a meningeal encephalitis. This is basically inflammation of the brain and also meninges. It's rare but very high mortality, high fatality rate. It's caused by 2 specific amoebas. So the first one is Naegleria fowleri, and the second one is Ankatamoeba. So these are basically brain-eating amoebas, and their goal is to just eat the brain. That is how the summary of everything. They basically cause a massive destruction of your brain and your spinal cord tissue, and then just attack it, leading to your brain size just decreasing. And once your brain size keep decreasing, you can't survive, because you need that brain size to maintain your day-to-day activity, including pumping of blood to your heart, from the heart, and regulating basically your body temperature and is everything that you have. So now let's talk about the transmission. The first one, which is Naegleria, infections are being reported in people who have been swimming in warm and also warm bodies of fresh water. And then most common one is native pot cases, which is in tap water. And then the next one is Ancytomoeba, which is which is more transmitted through when you have a broken skin or you have conjunctiva. And then leads to entering in your lungs, and you get it through your lungs epithelia sometimes too. And basically on this graph shows the distribution of cases that we've been known since 1962 to 2017. As you can see, it's more higher in around this area, Texas, and then you keep going on and on. And as you can see, it's more common around those who are kind of closer um to the beach. So the amoebas basically force their way into your nasal passages and utilizes your olfactory nerve to enter your brain, and then they have access to your whole brain mass and do whatever they have to do with it. This disease is basically known to have about 2 to 3 percent of survival rate, so it's basically super terrible. So now let's talk about acute encephalitis, which is basically the inflammation of your brain. So as you can see, this is how a normal brain look like, and when you have the disease, you have this inflammation, which we can clearly see over here, and then your brain is too inflamed. And as you can see, once you have an inflamed brain, your probability of dying is higher. So what are some of the signs and symptoms? You have behavior changes, you have confusion, you have decreased consciousness and often seizures. And then you have some symptoms of meningitis, as we talked earlier on, because you have headache, so leading to some of changes in some of you have changes in how you feel in your meninges. It's basically caused by viral infections, and then these are some of the known viruses. Particular classes are arboviruses, which include Nest Nile, Lacrosse, and the list goes on and on. We also have HSV1 and HSV2. It's transmitted through arthropod vectors, and also in some cases we have the vertical transmission, which is depending on which kind of causes that you might have. So now let's talk about the arboviruses. So as I mentioned earlier, the arthropod vectors are their main mode of transmission. They are spread worldwide by cluster in tropics and subtropics areas, and they are periodic and pandemic in also temperate zones. They've been known to have peak incidence usually late spring and through early fall. They are mostly present in warm-blooded hosts to kind of maintain their infection during the cold and dry season. And as we all know, it's very hard for viruses to be active and alive, mostly around like living hosts. They need them to be able to survive. There have been millions of infections per year and thousands die. There's no treatment for most arbovirus infections. And these are the top 5 arboviruses causing encephalitis in the United States. First one we discussed is the West Nile virus, and then you have um, You have it in the insert, and then it kind of goes into this bed, and then the cycle keeps going on and on. And clearly you can see a number of cases recorded only in 2013 is 2,469. And then we go to the next one, which is La virus, and it goes from the vector to squirrels, and we have about 85 cases. And then we go to germ-time virus, which affects a lot of DS. So it goes in there, we have 22 cases. And then the cycle keeps going on and on and on for all of the rest. So now let's talk about the herpes simplex viruses, which is basically HSV1 and HSV1 and HSV2. So their mode of transmission is vertical. So they are known to cause diseases in newborns, which is mostly if you have an HSV positive mother. It's mostly prior to happening. There's also poor prognosis for this disease, and older children and adults, who are mostly older than 50 years of age, are also susceptible. Their transmission is through reactivation of the dominant HSV, which is already present. So now let's talk about the subacute encephalitis disease. Symptoms may take longer to show up and are less striking, because that's why we call them subacute. They are caused by these three. The most common causes of this disease are these three microorganisms that are here. We have Toxoplasma gondii, and which will lead to persistent measles infections sometimes. It's also common in patients who have persistent measles infection. And the third one is caused by prions. So let's take them one after the other. So the first one that we will discuss is Toxoplasma gondii. So Toxoplasma gondii are basically flagellated parasite. Their primary reservoir is in felines, basically cats, and they are extensive. They have an extensive worldwide distribution. So people who love cats all around the world might be prone to getting this kind of microorganism infection. And some of the signs and symptoms include usually being having asymptomatic infections, and you have sore throat, lymph node enlargement, and low grade fever, which is very subtle. Infections can be in the fetus, and also if you have an immunodeficiency patient, which will get more prone to getting this infection. Obviously, it will mostly lead to fatality in this patient. So now let's discuss Toxoplasma gondii infections during pregnancy. So it's more common in about 33% chance of mother's transmission infections to the fetus. That's when the mother have it. They have about 33% chance of transmitting to the fetus. It causes congenital infections in the first and also second trimesters, which are associated with stillbirth, liver and spleen enlargement. You have sometimes liver failure, you have convulsions, and also damages to the retina, which will obviously lead to blindness. So as we can see from here, you have the pseudocysts present in the mom. Now mom enters, mom is pregnant, so the pseudocysts will go through the sexual phase where it have to divide and produce another daughter cells, and then within the mom get to pass it on to the offspring, and then the whole cycle keeps going on consistently. In the second mode of transmission, you have the oocyte. You have the pseudocyst present and it can infect the oocyte, which is your baby, and now the cyst just grow. Maybe let's say after stillborn or something, you throw or bury the cyst outside. Let's say you have a stillborn, basically, which is like premature death of the kid. So basically an unplanned abortion. You have to bury the child, and then the child with the cyst which is already present in the child goes outside to the environment. gets into another carrier, let's say a cow, and it just comes back to the human when we consume the meat. So it's just going around the circle. So it's either you are sending it through your child naturally, or it goes into the environment and come back again. Next on our list is the mesoviruses, which is the subacute sclerosing, and which is basically a slow virus infection. Symptoms appear years after initial meso episode. So if you have someone who have chronic meso episodes, you are prone to getting this. It's caused by direct viral invasion of the neural tissue. It's basically unclear what factors lead to the persistence of the virus in some people. And sometimes you can get it as late as 17 to 15 years prior to you getting these meso episodes. The next one on our list is prions, and we've discussed this in one of our earlier lectures. They are basically normal proteins in the brain, and basically you have a normal protein in the brain which is transformed into a prion protein. We don't know how or what causes them to transform. The auto protein just basically simultaneously converts other proteins, which are normal proteins, into prions. So as you can see from here, let's say have the first protein, which is this PPSC, which is the let's say the infected prion protein. This prion proteins changes, this protein changes to prion, and then it start converting all other normal proteins into prions, and then within a couple of years or months, you have more proteins changing into prions, which then causes a plague and or more of a spongy damage holes in your brain. And so let's talk about spongiform encephalophytis. So basically the spongy phase of the prions. So it's implicated in chronic and persistent diseases in humans and also animals, with more than 11 identified causes. Um, we have brain tissues. The brain tissues have to be removed from infected animals and then reassembled as a sponge. So basically you have a healthy brain here, and then when you get infected, you have your brain tissues being damaged and turning into a sponge like in the disease stage. So some of the disease that prions cause include Creutzfeldt-Jakob disease, which is it causes gradual degeneration and death of your brain. So now you have your brain being degenerated and basically it shrinks, which leads to your death. Several animal victims of have been known to be several animal victims of similar disease have been reported. We also have a crepey, which is seen in sheep and milk elk, and we have bovine spongiform encephalophytis. I'm sorry, encephalopathy or mad cow disease, which is more common in cows. Next on our list is rabies, which is a slow, progressive zoonosis characterized by fetal encephalitis. It starts with non-specific symptoms, example vomiting, fever, headache, and then it develops into two forms. We have the furious rabies, which you experience agitation, disorientation, seizures, twitching, and hydrophobia. And then the second one is damp rabies, which is caused by which you experience paralysis and stuperosis and also disorientation. Both form progresses to coma phase and death. So it's more like a one phase, a one-way disease where you start from not being severely damaged to leading to your death. Death results mostly from you having a cardiac or respiratory arrest, and pretty much no one survived. Only a few patients have ever been known to survive. So once you get rabies, it's more of a good luck to you. So yeah, this disease is caused by the rabies virus, and the known reservoirs that we know are wild mammals such as canines and dogs. We have skunks, we have raccoons, badgers, cats, and bats. The virus ends up in the saliva, so unless you get bitten, scratched, or you inhale droplets of this virus, or you have worst case scenario cornea implant, maybe I don't know how you're going to get it, but if you have a dog spit in your eye or something, that dog have it. That is the only way you can get some of these you can get the rabies infection. So apart from bite or scratch, that is the weird way of you getting it, which is like a spit in your eye or on your cornea. Um, there are vaccines available for rabies prior to you getting your infection. So people, most of the time, people who work around canines and raccoons are being encouraged, specifically vets are being encouraged to get vaccines to protect themselves. So the incubation time for the virus mostly is within 1 to 2 months, and sometimes more. So it's very hard to detect it. Now, last something to also discuss is poliomyelitis, which is an acute infection of the spinal cord and your motor neurons. Signs and symptoms include fever, headache, nausea, sore throat, and myalgia. And also, you have neuromuscular paralysis. Basically, if you have your motor neurons are being affected, um, which form the circuit for controlling your muscles. Basically, you can't move your body, so then you have neuromuscular paralysis. This disease is caused by the polio virus, and which is widely known. For that reason, you get vaccinated mostly when you are young to protect you against this. The transmission is through humans and only humans, which are the only known reservoir for this. And then we also have fecal oral transmission, and sometimes through this vehicle, which is a fecal oral transmission, and for you to have it. So unless you, I don't know, unless you kind of have an infected person who had feces and somehow spread it on doorknobs or something like that for you to kind of get it. And then, as you can see, in 1998, it was more prevalent in Africa, Asia, and also the North Americas, and it's all known. As up to 2016, most of these cases have been eliminated through the vaccines which has been given to infants once they are born. And as you can see, as in 2016, they have less of a polio cases been reported. So that's a great job done by science, where we have severe infection, and about several years later, from 1988 to 2016, we have almost a complete eradication of polio. Now, the next of our list on our list is tetanus, which is a neuromuscular disorder or called the lockjaw. And then common cause is caused by Clostridium tetani. It's more common in soil and also in animals' GI tract. And basically, they forms endospores. So then don't step. What you have to do is don't step in on a rusty nail, because then you have these endospores mostly more present on them. Is for that reason, because you have to get like a rusty, you have to step on something rusty to get it, whether a nail or rusty sharp object, let's say a rusty blade or something, any sharp object that is rusty, you might get it. So something that have been in the soil before and it's out there, you can get it once you step on it or you get cut with it. So for that reason, the mode of transmission is parental or direct contact. Then, as we discussed, so if a nail has been in the soil and you step on it, you can get it. And then maybe let's say a rusty nail, a rusty razor or something, you will run at a risk of getting it. So how it works is it produces neurotoxin against your peripheral motor neurons, which blocks your neurotransmitter releasing, and basically you can't stop the contractions that is happening, and it results in a static paralysis. So then you can move. So we have that 10 to 70% fatality rate. Vaccines with tetanoid toxoids, which gives about 10-year protection, is known. I think most of you by now have tetanus vaccine injections. We have neonatal tetanus, which is more common in developing countries, as I mentioned earlier. Mostly they give it to you once you have been born. They give you vaccines once you have been born against tetanus um, to protect the infant. So next on our list is botulism, which is which is more intoxication more often than true in infection. So it's more of an intoxication compared to getting a true infection. It's caused by Clostridium botulinum, which is basically the endospore. So so how it works is the botulinum produces toxins, the neurotoxin, which basically affect your neuromuscular junctions of your skeletal muscle, resulting in flaccid paralysis. So um, we actually use this for medical reasons, mostly when you go for Botox, specifically those who do cosmetic surgery for Botox. So this is how it works. So now you have your muscle in your motor neuron end plate, where you have your motor neurons, which is basically and lives closer to getting closer to your muscles here. So then you have vacuoles which are present in that area, and they have to release this acetylcholine, which have to bleed into your muscles and then cause the instructions. Then you have your butylene, which is basically the toxin which is released by this pathogen, and then basically it blocks the transmission, which then wouldn't give the instructions the muscle need to kind of move, making it stiff or having a flaccid paralysis. So basically that's how the disease works. So it's mostly transmitted through vehicle, which is more of a foodborne toxin. And we also have direct contact, which can be through wound, and we have the parental one, which is through injections. There are three major forms. We have the foodborne, which is you have a toxin or an endospore in your food, and which is like poorly preserved food. And then it's more common in home canning when you kind of do it yourself. And then we also have infant one, where we have infant infection, which is mostly more caused by the endospore, and we have bone infection, which is also caused by the endospore. The mortality rate is 5 to 10%, which means it's basically not a kind of a good thing to have any of these diseases. They've been known to be about 10 to 30 outbreaks per year in the United States, and these diseases have been associated with eating poorly preserved food. So this will be all for today, and hope to see you in class. Okay, bye.